There are a lot of ways that cancer and its treatments might impact someone's sexuality. It's going to depend a lot on the type of cancer, the type of treatment, etc. But I think some of the really common side effects of cancer treatment are things like fatigue, nausea, hair loss. These are things that can really impact someone's libido or feelings of being desirable or energy to engage in sex. So there are those physical side effects that are pretty common. There are also psychological effects that can happen with cancer and its treatment. Feelings of grief, anxiety, loss, anger, sadness, all of those things that might impact how someone feels sexually. Also, this depends on what the cancer is, but sometimes there are very direct effects of treatments on sexual functioning. In addition to those broader areas, things like if someone needs a hysterectomy as part of treatment, that is going to impact potentially someone's sexual functioning. Erections can be impacted by treatments, some blood vessel functioning. Some treatments directly affect hormones. That can impact how someone is functioning sexually. I think the most overlooked sexual side effect is actually a really broad one, and it's the medical trauma of it all. Cancer treatments can directly impact sexual functioning, but on top of that, for a lot of people, if you've been through cancer treatment for years, your body becomes a site of medical trauma. It becomes this thing that has been poked and prodded and tested, not a place of sex or a place of safety or of feeling at home. And so I think that is something that can be overlooked or that's often not discussed with patients ahead of time and can have a really large impact on how people relate to their bodies. I was lucky enough to be part of a research team that investigated the impacts of sexual health for gynecologic cancer survivors, specifically survivors' experiences with their care team as it pertained to sexual health and sexual health information. As part of that research, we spoke to a lot of different folks who were survivors, and we had focus groups. They would get together and talk about their experiences. Some of the major findings were related to the lack of communication. Our participants talked about not receiving information about sexual health and the side effects of treatments, which a lot of the treatments for gynecologic cancer directly impact sexual functioning. They are directly targeting genital tissue. A lot of the treatments end up putting people into early menopause. So there are sexual side effects, but people weren't prepared. In fact, some people even received inaccurate advice. One of our participants, I remember telling us that her provider told her getting a hysterectomy would make sex better. And then when that wasn't the case, she was shocked and confused, and it made it a lot harder for her than if her provider would have just been upfront or at least conveyed the whole story. Other finding that's memorable to me is just the feeling that sexuality wasn't valued. A lot of people had the same story of being made to feel like, well, be thankful you're alive. It doesn't matter if you have sexual functioning impacts or if you're experiencing these problems. Be grateful that we got the cancer. I think that was a really common experience that people felt from their providers. Our participants also talked a lot about what would be helpful, what they wanted from their providers. Part of that was being given information on sexual health and sexuality kind of continuously throughout their treatment. If you're being told right at the beginning of your treatment, it can be really hard to take in that information. You are taking in a lot of information about what's about to happen. But if you're given information along the way, reminded of resources, that can be really useful. A desire from our participants for their healthcare providers just to bring it up. Some of our participants wanted to bring it up, but didn't know how, didn't feel like they could. They weren't sure if it was allowed. And the preference that providers really take the responsibility to bring up the topic and allow that conversation to happen. I think that providers have a difficult time bringing up sexual health with cancer patients for a variety of reasons, the main one being lack of training. A lot of healthcare providers across different fields do not get proper human sexuality training. And so that leaves people unsure of how to bring up the topic. It can be uncomfortable for people who aren't getting practice knowing how to bring up the topic of sex. I think another thing that comes up, and what I have heard from cancer patients describe, is the feeling like sexuality is not top priority during cancer treatment. And I think for some providers, of course, their priority as doctors is fixing the medical problem at hand. But oftentimes, what that means is a disregard for people's sexuality in the face of something like cancer, which can be life threatening. A lot of providers aren't necessarily thinking about how important sexual well-being is to someone's quality of life. They leave it out with the assumption that it doesn't matter as much to their patients. My understanding from working at a medical school and from knowing people who provide sexual education to medical students is that it is not really a comprehensive or required part of medical school training. Then when you do residency and specialize, you're very focused on what you're doing. I can speak to that also from other trainings. I am conducting a study right now on clinical psychologists, and the same thing, there's no sexuality training across the board. And I know from that perspective, which might be the same for medical providers, there's so much required for accreditation. There are so many courses that it is often, because it's not required, it never gets done. Programs aren't prioritizing. And then because we don't have psychologists or doctors who specialize in this, they're also not providing that education to students. The problem keeps going. In terms of how to bridge that, I think it needs to be a part of medical school curriculum, but then also maybe like continuing education. The researcher I did that study with, I believe, is doing research to figure out providing training to oncologists. So I think there's an opportunity for people, even once they're specialized and practicing, to learn about sexuality and sexual health from trainings. If someone is wanting to bring up the topic of sexuality with their care team but is feeling uncomfortable, intimidated by that, I think one of the most helpful things that you can do is create a list of questions in advance. So write it down, whether it's on your phone, whether it's on a sheet of paper, but come into that medical appointment with everything you want to ask written down in full sentence format, so that if you get anxious, if you get uncomfortable, all you have to do is read off the sheet of paper. You can even message your care provider ahead of time and say, hey, I want to discuss these things. Here are some of the questions. So that might actually prepare your care provider a little bit more to talk about those things. But I think that is one of the most useful strategies. And then in addition to that, don't be afraid to bring someone with you to your appointments that can help you with that and help you navigate that, whether that is a partner, maybe a nurse on your care team who is really supportive. Lots of cancer treatment centers will have care advocates whose job it is to help you navigate those situations. And you can always bring someone with you to help you. If you or someone you know has had to navigate this situation and you found resources that were helpful, please drop them in the comments below. Share the wealth of information. So for queer people who are navigating cancer and navigating the sexual impacts of cancer, there are some unique challenges. One being, we know that LGBTQIA2S+ folks are discriminated against in medical settings. There is that layer across the board. In addition, a lot of medical health providers do not have training in sexuality topics, also a lack of training in queer issues. Those combined make it even harder for queer folks to get adequate care and can oftentimes be really harmful for queer folks who are entering those spaces. A lot of the harm comes out of a lack of knowledge, a lack of training, but also I think about trans clients in particular. Depending, a lot of treatment centers are very gendered, and sometimes someone will need to go to a women's center for a type of care, or sometimes the site of cancer, the site of surgery is labeled something that is not what the patient labels that part of their body, and can be really distressing to hear over and over again. This is a particular intersection where there is not just a lack of knowledge and training, but a lot of active harm being done to clients in those spaces. What we can do, again, training is one of the most important things, making sure that medical providers not only have training on queer issues and sexuality, but what are the unique needs of queer people when talking about sex specifically? And how can you make sure that the way that you practice the words that you use are not causing harm? I think finding a queer cancer support group can be incredibly useful, especially for clients who are navigating discrimination, biases, assumptions, being able to talk with other people and have them point out, hey, this is actually not okay, or I've been through this too, and it also hurt me. There's a resource I mentioned in the blog called Frankly. It's specifically a cancer resource for queer folks. So there are resources that exist, but I think having a support group is really a critical piece. For cancer survivors looking to heal and reclaim their sexuality, there are helpful resources and options. Cancer support networks are a huge one. People find a lot of support, a lot of understanding from being able to speak to others who have gone through what they've gone through. And also, oftentimes, people will hear about resources that they wouldn't have heard about otherwise from those groups. So I think cancer support groups can be a really important part of that process. In addition to that, therapy with a provider who understands sex and sexuality, so a sex therapist, can be very, very useful. A therapist who specializes in cancer and its effects could be a good avenue. Someone who understands the importance of this, I think, is really critical. So talking with someone about what it means to really grieve the losses that someone has experienced and then learn how to be curious and accepting of new experiences. Therapeutically, how we might help someone reconnect with their body and their sexual self-esteem after going through all of these body changes, allowing people to fully process what has happened instead of rushing right to, well, how do I feel good in this body? How do I feel immediately ready to have sex and feel sexual? Mindfulness practices can be really useful. And so when I'm talking about acceptance, I'm talking about radical acceptance. So, not necessarily liking that these changes happened, but being able to accept that they did. And so how can you approach your body from a place of compassion and patience and curiosity? How can you think about relating to your body in a different way? I think the other thing with body changes is being able to communicate that to a partner. Sometimes, yes, there is the difficulty that comes with going through this, having massive body changes, changes to self-identity, but then also this added layer of partners not necessarily understanding it, or, people have told me that they feel pressured from their partners of like, well, why can't you just move on or get over this? And so I think also a piece of that is letting people know how to communicate that to partners so partners can show up in a way that is helpful and can foster resilience. When partners show up in ways that communicate, hey, I love this about you, or I understand, or I'm grieving with you, I think that allows more healing to take place. Some people do feel guilt for not feeling ready to engage in sex, or maybe they're engaging in sex, but they're not enjoying it like they used to, and that can bring up feelings of guilt. If they're not wanting to engage in sex, if they are saying, no, not right now to their partner, and the partner feels rejected by that, then there can be a dynamic that can be really difficult for some people to navigate. I think one of the things that can be useful is being able to communicate about exactly what's going on. Oftentimes, the partner who feels rejected is feeling rejected because they think that their partner doesn't want them, or they think that their partner doesn't love them or finds them desirable. Usually in this context, the partner who has had cancer and cancer treatment is having a difficult time adjusting to the way their body feels and connecting with themselves sexually. It usually has nothing to do with the partner. And so that can ease a little bit of the distress when a partner can explain that to the partner who feels rejected. And then that allows the partner who feels rejected to maybe show up in some different ways, in some ways that are a little bit more supportive, or it allows for problem solving. So, for example, if someone is having a hard time with their body, how do you create a more relaxing context for someone to ease into sex? So, maybe the way that you used to initiate sex doesn't work now, but after a long bath with candles and all of the laundry done, and maybe some connection and feeling of safety, maybe then sex is accessible. So it allows problem solving to happen when you can communicate. One key message that I would like to get to people around sexuality and cancer is that it does not have to be thrown to the wayside. So, yes, it's great if you survived cancer. That's amazing. And if you receive the message that that's it and therefore sexuality doesn't matter, that's incorrect. For a lot of people, sexuality is a part of living, it's a part of vitality, it's a part of feeling alive. Your sexual health, your sexuality matters to the extent that you want it to. There are people you can talk to, groups you can go to, resources, and folks that understand that's an important part of your life. If you resonated with any of this, be sure to like and subscribe for more helpful content.